when there is a need for oxygen consumption by an organ, it's not just only oxygen, it's the nutrients too. So if the organ does not get appropriate oxygen or nutrient, the first sign of it that it's happening is pain. So whether it's angina of the heart because an artery in the heart is not giving enough blood flow, versus it could be angina of the leg, which is that pain of the leg. So angina is mainly a description of the pain as a result of lack of blood supply, which is lack of oxygen. You know, when you're hit with chest pain, you get scared, you know, because you know that's #1 killer. Next thing you know, oh, am I going to have a heart attack? So right away you go and, you know, seek help. When it's your legs, you procrastinate. You just feel like, okay, something maybe I did, and it just becomes a lingering problem, and it becomes a chronic problem, and they forget about it. They just write it off as, you know, getting old business, the daily pain and aches that we all have. But again, a lot of it is in awareness, and if people are aware of their risk profile and know there's something wrong. They used to walk 2 miles every day, and now all of a sudden, wait a minute, I'm not even walking. You know, I walk just to my car and I'm tired. The circulation in the legs are you know, affected by multiple variables. So again, risk factors for that would be aging is major. Whether they have diabetes, it's another. Tobacco is extremely, like folks who smoke, they have like 10-fold higher risk for development of circulation abnormality. Sedentary lives, you know, that would lead to venous insufficiency. People who are very large and overweight or have apnea, they have blood flow abnormality in their lower extremities because the return of the blood to the heart is affected. So they have venous engorgement. The blood doesn't return back to the heart as nice as it should. So they get these legs enlargements, which is the blood flow that is stagnated, and then it leads to discoloration and skin changes and sometimes blood clots in their lower extremity veins. So not everything is arterial circulation. They can very well have venous abnormality, the return of the blood flow. So again, careful attention to history, who they are in life as what we call patient characteristics, how many risk factors they have for development of such problems. And then the next step is physical examination. If you took a careful physical exam and a careful history and going and reviewing the signs and symptoms of this patient, you should be able, without test, to diagnose the patient more than 90% of times. It's just by your history and your hands and feeling their pulses and inspecting their legs and touching them. It can be venous insufficiency, which, yes, you can have leg pains and all that as a result. And then other things secondary to that happens, which is like blood clots in the leg, discoloration, and then things that back up affecting the joint space. You know, there are secondary complications that may arise from that. Then the second diagnosis can be peripheral arterial disease, meaning lack of blood flow coming towards their toe, you know, at whatever level of obstruction, a blockage they may have. And then the third one is what we call arthritic pain, musculoskeletal pain. You know, with a careful attention to history and physical, you should be able to narrow it down to those three really nicely.